if you have any update on your conflict of interest, please go ahead, Kent.
Yeah, Kent Hutchison, professor of psychiatry, and yeah, I have no new conflicts.
Thank you. Joe, go ahead. Next.
Joe Schacht, associate professor of psychiatry at CU Anschutz. Also no update on my conflict of interest.
Thank you, Joe. Paula, you're next.
Similarly, no updates on conflicts. I am a professor at the University of Colorado School of Medicine.
And again, I'm Chris Rubina. I'm a public health advocate, as well as former head of CDPHE and other things. So I think that's all of our members of our SRC. John, you want to introduce the staff that are here today?
Yeah, let me go down. So this is John Samet, Dean of the School of Public Health, and leading the project and sitting in Scotland at the moment. Let's see, Tianjing.
Hi, this is Tianjing Li, Associate Professor in Ophthalmology, part of the Systematic Review team.
Nilu.
I am Nilu. I'm helping on the administrative side.
And let's see, Bobby.
Hi, I'm Bobby. I'm Dean Samet's assistant.
Greg.
Hey, I'm Greg Tong. I'm an associate professor at the Colorado School of Public Health, and I'm part of the administrative core for this project.
And Jean-Pierre.
I'm Jean-Pierre on the systematic review team.
And Louis.
Louis Leslie. I'm one of the people on the systematic review team.
Let's see, and I saw Ashley, and then she disappeared.
Yep, I'm here, Ashley Brooks Russell, subject area expert.
Muki.
Yes, Muki Riti Pyro, one of the systematic review team members.
And Lisa.
I'm Lisa Barrow, professor of medicine and public health at the CU Anschutz Medical Campus and on the systematic review team.
And Tianjing.
Introduced myself already.
That's what I was wondering. I thought you did. People are jumping around on this. It's not fair.
No problem. Thank you, John. I just want to remind
actually, Megan is still
Megan. Thank you, Megan.
I'm Megan Buran, Senior PRA to Dr. Samet in the Administration Corps.
And I'm not sure, did I miss anybody? Okay, Lisa, you did?
Yep, I introduced myself. Thanks.
Okay, all right, then we're done. Okay.
Thank you, John. So I just want to remind everybody, not only our participants here on the conference, that this is being recorded, and any comments you make are live for the audience. We have lots of participants that are also listening in. Looks like our total number of participants, including us, is 31. So I just want to review the agenda. Next slide, Nilu. Thank you. It's going to be a fairly brief meeting. We've already covered the first couple things, including this agenda. Tianjing is just going to give us a very brief update where we are on the extraction. John will talk about the final draft of the report and solicit some comments from our group. And then we're going to finalize our future, not our actual dates of our SRC meetings in the future, but what we are expecting to have over the next couple months. And that'll be our shortened agenda. It won't go until 2:50. So, all right, next slide. Just also, we want to remind folks that what our charge is. It's all on our resource page on the Cannabis Research and Policy Project. We put up the minutes, we put up all the slides. So, and also I know the research team has looked very carefully at the comments that was submitted and responded to them as well. Next slide. So Tianjing, you're on for as long as you want.
Sure, it will be a very quick update in terms of the data extraction progress. Just to remind everybody, our comprehensive search resulted a little over 46,000 records, and we're extracting data from 489 randomized controlled trials and observational studies. We have completed data extraction from 56% of those 489 records, that's 274. And of those 274, 43% of them have been verified by a senior methodologist. So we're making steady progress over time.
So just a question for you, Tianjing. As you completed the extraction, just for the public's sake, will those be added to the dashboard, the Tableau dashboard?
Is Rosa on the call? I think we added 68 studies or 84, at least I'm forgetting the number, to the dashboard already.
Yeah, 68 there, but Rosa's here. So go ahead, Rosa.
The dashboard is updated with the 60 extracted studies that are included in the report with the same link that you've been using to access the dashboard.
And when do we anticipate, Rosa and or Lisa, that the public will be able to access the dashboard? I know we're allowing the SRC members to have preliminary view to kind of play with it. What are your thoughts?
I think once we have all the data extracted, that would be a good time to do it because, I think it'd be better to have public access when we have the full picture. And I know Rosa can give you more detail on this, but she's created some software or code that will allow kind of the automatic uploading of the data extraction as it occurs. So that's not the issue.
Yep, exactly. So now that we have the 68 studies in, it should be more regular to be uploading the data into the dashboard.
So from an SRC perspective, obviously our folks can continue to look at it while we're waiting the full extraction. Is that correct?
Yeah, and there are two new buttons on the dashboard, one to provide any feedback on the dashboard and the other to flag any miscoded references. And those directly email me and John Pierre. So please use them freely and we will do our best to address any comments.
Thank you very much to both of you. And any questions from the SRC members that are with us for Rosa, Lisa, and or Tanjing? I don't see any, so let's keep on going. John, you're next, I think.
Actually, maybe Tanjing, give approximate date at which data extraction will be completed and verified.
So absolutely for, the first round of data extraction, it should be done by the end of July. And then the verification is ongoing. It may take, 2 or 3 more weeks after the data extraction is completed by the student workers.
Okay, and I just want to note that what we've done in the report is the exposures and outcomes are based on the first 68 that have been verified. And we will provide an additional note just saying as of, today or tomorrow, the report will go in July 1. Data from X additional have been extracted but not included in this report because of course we need time. But I think the main point is really captured by what Tanjing said, that we are now moving quickly on the data extraction. The verification will take some time. So I think at this point, just to describe where we are with the report, yeah. Sunil, if you want to go ahead. Yeah, so the report that we sent out to the SRC last Friday was a version that we considered, very close to complete from the perspective of the team and the work that we are doing, and felt it was ready for SRC comment. It includes a discussion and it includes next steps. The next steps largely being that we will be completing data extraction, verification of the data, certainly within 2 months. And at that point would be able both to give a deeper dive into the literature, to talk more firmly about next steps, given that we would have a better capture of the scope of the literature. And we would be in a position to make critical recommendations, both for next research, for methodological concerns that need to be addressed, and more. So this report, from my perspective, documents that we're quite far along in the review, and that we will be able to bring this first phase of the review to a closure. We also speak to what might be done next in terms of further reviews, systematic reviews, all depends on what we find and what the scope of the literature is. So let me ask, particularly Lisa and Tanjing, if you want to add, Greg, Ashley, whomever else. It looks like sounds maybe Nilu,
Well, I could add a little bit about, after we have all the data extracted, the next step would be, check the data and generate some tables that will be helpful for synthesizing the information across studies. Lisa and I probably have a lot of templates we can use as a starting point, but we may get feedback from the SRCs in terms of what you would like to see in those tables, in terms of cross tabulation, for example, and our summary text will be based on those tables.
yeah. And we'll also know, within a particular category, how much information we have and what it may look like. And as we've discussed, the SRC will have access to the data. I was going to say, Nilu, if you have the report, if you could put up the and just where it is at the discussion and the next steps, just maybe, because I think those are probably the most critical pieces for discussion. The SRC has seen the remainder of the report.
And maybe while that's coming up, John, I'll just, this is Lisa, note one other thing is the dashboard. We have certain questions that we're posing to the evidence map, but as the SRC digs into that more, if there's any other questions that are raised, there's data behind the dashboard that can be displayed in various ways.
Yeah, and so if you go back up just a little bit to the discussion. So we provided a fairly straightforward discussion of the findings and made some comparison to the other authoritative reports that have been done. Probably still need to clean up a little bit our table that quotes those other reports. And so they here comment on, some of the challenges that we find in literature, and then going down to next steps. You can do that. Yeah. So, here we basically talk about understanding how much data we have, the first bullet, and the second, will it be enough to do some focused systematic reviews on a particular exposure outcome pairs, dose response, wherever the data seem to be sufficiently abundant. And then, and certainly from this review at that point will come the ability to characterize critical research gaps. So aiming towards a report in September. So I think those are the key things, and can probably stop here, Chris.
Sure. So any comments for John on these, not only the discussion, but the next steps from our SRC folks that are here? I'd like to make one comment while we're waiting for other folks to kind of put their thoughts together. I was very impressed with the quality of the report. I saw throughout the language, not only in the methods, but some of the analysis and the discussion, many of the points that the SRC had raised as we went along, which I thought was very useful. Not only the issues around health equity, but the issues around tolerance, around potential for dependence, issues around chronicity, and so all those issues that we had raised all along were incorporated into the body of the report. So I appreciate that, because I had been keeping a list of those and trying to figure out how they would be appropriately placed into the document. So thanks for doing that. That was well received from my perspective. So
Yeah, no, the comments have been very helpful, I think. We appreciate them.
Go ahead, Joe.
Thanks, Chris. I was just curious. There's an allusion that at the last paragraph here to submitting the report in advance of the next session of the General Assembly. Is anyone aware? Are there activities in progress in the legislature to restrict THC content, and will this report be submitted in a timely enough way to have an impact on any of those activities?
I'm going to appeal to Greg and see if you have any knowledge of this. I mean, I'm not aware of any specific activities at this point. I mean, I think and we say that, Joe, because we think it's if there were, this is obviously the time to get it in. But Greg, do you have any comments on this?
Yeah, we're not aware of any specific efforts right now that are kind of running independently of the work that we've been charged with. I will point out that a lot of discussion around the potential of doing that, and then specific discussions around what levels restrictions should be put in place, was part of the initial motivation for the legislation that created this effort. And so there might be other discussions and other things that we're not aware of, but I really see the legislature is turning to us as partners to help bring back the information to them, and then for that to inform next steps, of course, from a research perspective and policy perspective as well. So I see this as, from what I'm aware of, the kind of core effort that's informing that moving forward. Good question.
Other questions from our Paula, Kent, or SR folks that are here?
Sounds reasonable.
Great. Well, thanks, John. I think you have your comments. I just had an open question for you and the research team. I don't remember that we actually had to approve this. As I understand the legislation, the charge to the SRC is we will review the data, we review the research studies, the protocol, provide input into the final report, but that we didn't actually have to have a consensus vote of approval. Is that your understanding, John?
That's my understanding as well, Chris, that, yeah, that you provide input, and you certainly have, and we've tried to respond, and I'm not aware, there's not a quote sign off, and as we discussed, the SRC can offer its recommendations, and we will certainly be making more. You might note that we talk about next steps here. We don't yet talk about recommendations because we felt that we should complete the data extraction and have the opportunity to fully review it before we move on to recommendations. We certainly will have some.
Right. So I hear what you're saying, John, is it's premature. I mean, obviously, you're not looking at all the data. It's not all available. Maybe premature.
Right, exactly.
Is that correct?
Exactly. Yeah,
Okay.
yeah.
Great. All right. Any other input from SRC folks or questions? Seeing none. Wow, this is great. All right. Well, thanks, John, and thanks for the hard work of your team. Again, compliments to putting a good report together, and including the SRC's comments. Nicely done to the group.
Good. Well, thanks. And thanks to the team. People have worked hard over the last weeks to get this together. And, it's almost by definition, there's always something more to do, but we think that a valuable resource is being assembled.
Great.
That will be unique.
Great. I think it will help with us all move forward in our understanding of high concentration THC. All right. Next, thank you, Nilu, for putting up this next slide. Well, at this point, from a SRC perspective, we had played with having small groups. We had played with coming up with our own report or recommendations. I put together a long list of what I heard over the minutes over the last 7 or 8 meetings that we've had. And I'm kind of drafting a letter, maybe a response that we don't necessarily have to send right now, but I would like to consider having us have a working document that we might use to share internally among our SRC group that we might present future at an open SRC meeting. But at least I wanted to keep a running list of all our issues that we've raised as we go along. And I'm going to circulate that with fairly soon, over the next 2 or 3 weeks. I think it might be premature because we just have a preliminary report to make any specific recommendations, because we're still in the throes of looking at the data extraction. So for Paula, Kent, and or Joe, does that sound reasonable at this point from your perspective?
Absolutely. I think
That
that's,
sounds
yeah.
Yeah, I agree.
Okay, so it sounds good. We have a consensus of 4 of us. That's great. Okay, so hopefully you'll see something in the next 2-3 weeks, at least as a draft of a list of things that we've raised. And I think most of them, as I said earlier, have been included in the report, so that's good. But I do think there are lots of questions that we still have as a SRC advisor to not only the research team at the Colorado School of Public Health, but also to the legislature in the future. So having said that, John, your thoughts about a meeting later this summer, maybe August, September? What are your thoughts?
Yeah, I mean, I think, Chris, going with the timing of the completion of data extraction and its quality control and our ability to present the right tables that show the extend the evidence that we've been able to gather. I think that point, and I think that's probably somewhere in mid to late August.
Okay.
Perhaps as we roll back, but let me see. Tanjing and Lisa seem about right to you?
I think late August sounds very reasonable.
Yep, I agree.
Okay, so we'll, Bobby, if I can ask, or Megan, or Nilu to kind of maybe put out a note, and we put it, as we put out the summary of minutes, we might want to send out an email to all the SRC members that what we decided briefly at this meeting, what went in with the SRC recommendations and support of the report, the preliminary report going in, but also that we're tentatively going to have a meeting in late August after the data is extracted and have more of a discussion. Does that sound reasonable?
Yeah, it does.
Okay. Thanks, John.
Yeah.
All right. Any other comments from SRC or the research team about where we are?
Well, we're heading to the 1-year anniversary. And I think considering we launched probably early August, I think we've come a long way pretty quickly. And I think we're fortunate to have, sort of the expertise of both, the faculty and the team available to be able to move so quickly.
Agreed. Kudos to the whole research team, and thanks to the SRC who have stuck with us multiple meetings in June, but also just your ongoing input and support of this very important work. So thanks to everybody. All right, I think we're done. Thanks, everybody.
Okay.
If you could stay on, or Megan, that would be great.
Thank you.